The sternum is from the Greek word stern, means breast. Hence, sternum is the breastbone. It is in fact an elongated, flat bone that lies in the midline of the anterior chest wall and is palpable throughout its length. You can see it as this highlighted bone here. Now, the sternum is actually consisting of further 3 parts. Let's zoom in to have a closer look at these. The upper part, this one, highlighted in green, is called manubrium, the body of the sternum. This middle part, highlighted here in yellow color, and the bottom part, called the xiphoid process, shown in blue color. Now, let's discuss them one by one. First one in the list is manubrium. The word manubri is Latin for handle. Well, previously, the sternum was known by the Latin term gladius, which means sword. This was because the shape of sternum resembles the short sword of the gladiators. So, the manubri refers to the handle of the sword. You can actually see the similarity. Quite interesting, though. Well, manubrium is the upper part of the sternum. It articulates with the clavicles and with the first costal cartilage and upper part of the second costal cartilages on each side, while inferiorly, it articulates with the body of the sternum, and this articulation forms the sternal angle, also called the angle of Lewis, which can be recognized by the presence of a transverse ridge on the anterior aspect of the sternum. The joint formed is known as the manubriosternal joint. Well, the manubrium lies at the opposite of the 3rd and 4th thoracic vertebrae. Now, if we have a look at the superior border of the manubrium, we will see a concave notch. Even you can feel it at your chest right now. This is known as suprasternal notch, also called as the jugular notch or fossa jugularis sternalis. Now, there's another oval articular surface present on both sides of the jugular notch at the superolateral corner of the manubrium. This is named as the clavicular notch. What they actually do is obvious from its name, clavicular, because they hold the sternal end of a clavicle. Now, the next part of the sternum is the body. As you can see here, that it is the middle part of the sternum and is relatively longer. It's about 10 centimeters in length at the superior end. It articulates with the manubrium, forming the manubriosternal joint, while at the inferior end, it articulates with the xiphoid process, forming the xiphisternal joint. Well, the body is composed of 4 parts or sternebrae, which fuse between 15 and 25 years of age. On the lateral sides, the body of the sternum has the facets for articulation with the 2nd to 7th costal cartilages. You can see here the 2nd costal cartilage notch, 3rd costal cartilage notch here, the 4th costal cartilage notch. This one, the 5th costal cartilage notch. Here is the 6th costal cartilage notch. And lastly, the 7th costal cartilage notch, where it articulates with the 7th costal cartilage. Now, coming to the last part of the sternum, that is the xiphoid process, which is in fact the most inferior part of the sternum. Well, the word xiph is Greek for sword, and the xiphoid process is the small and pointed end of sternum, just like the tip of the sword. Well, superiorly, you know that it articulates with the body of sternum at the xiphisternal joint, which lies opposite to the body of the 9th thoracic vertebra. There are usually no ribs or costal cartilages attached to the xiphoid process, but the 7th costal cartilage may have a shared attachment with the xiphoid process and the body. Well, that was about the sternum, where we have gone through the 3 parts of the sternum: manubrium, the upper part, the body of the sternum, the middle part, and the bottom part, called the xiphoid process. Now let's jump to the next section, to learn about the ribs and the costal cartilages.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.